This is the second meeting of the Directors of Health, separate from the Pacific Health Ministers meeting, and I congratulate you on making this happen. Pacific Ministers, at our closed meeting last year in Samoa, agreed that it would be of great value to have the Directors and Permanent Secretaries of Health meet separately to operationalize our decisions at ministerial level. And I'm thoroughly glad that this has happened, and we have enough time to separate the two meetings, so there's enough operationality arising out of this. The objectives of this meeting are obviously very clear to you, and basically it involves the review of the way forward for regional architecture of health, including establishing regional functions and governance arrangements. Secondly, it is to finalize the Pacific Health Development Framework and recommend to the Pacific Ministers for endorsement at their meeting in July 2014, and thereafter to make recommendations for the Ministers of Health and Economic Ministers on critical health issues and initiatives for the Pacific, including a roadmap for responding to the NCD crisis in the Pacific at the joint meeting too. Now, reviewing your agenda, I see that it is multi-layered, one followed by the other. It's quite intensive, and I'm quite sure that you will do justice to it. And essentially, the first item on it is to follow up the ministerial commitment from 2013 to provide an update on NCDs, mental health, and discuss what's happening in your arena in the Pacific Small Island Development States. In particular, the Pacific Monitoring Alliance for NCD Action, acronym MANA, is the platform for accountability requested as part of the NCD recommendations, and I'm glad to see that some of the progress will be discussed at this meeting. Secondly, a roadmap for responding to the NCD crisis in the Pacific. The Forum Economic Ministers meeting in 2013 requested that an economic and financial roadmap for strengthening NCD prevention and control in the Pacific be developed for their joint consideration in 2014 meeting. And this was to be possibly held conjointly with their health counterparts. As you can also see that the roadmap, I hope you will be able to finalize a document that will assist us in health to fight NCD a lot more appropriately. The third issue on the agenda, I note, is the Pacific Health Development Framework. At the 43rd Island Forum in Rarotonga in 2012, the leaders acknowledged the urgent need for strategic investment in health systems, and as a cross-sectional and a whole-of-country initiative to achieve better health outcomes at the national level and to be supported by regional initiatives. The resulting work of the Pacific Health Development Framework and finalization of this for our consideration is good to be noted. Again, we trust this forum to produce and provide the ministers a document that is owned by the Pacific and truly reflects the issues of our blue continent and offers Pacific solutions. I strongly recommend that you build on the Healthy Islands vision, and as host of the next Ministers of Health meeting, Fiji will be proud to champion the progress to commemorate the 20th anniversary of the Yanuda Declaration, declaring and chart the way forward for health in the Pacific. Finally, let's look at surveillance and outbreak response. We are in Fiji just recovering from a dengue outbreak, and I hope your discussion in this area and with relevant to Zika and chikungunya, which is also plaguing other parts of the Pacific, will result in better means of prevention, screening, treatment, and follow-up. In the area of sexual health and well-being, can I just note that this paper is a combined effort of the partner organizations involving sexual health to have a more integrated approach to the subject and to be addressed widely in our growing population of young people. The key directional focus is a shift from the silo programming for STIs and HIV, and to integrate this with general health services and make it a lot more horizontal with a broader sexual and reproductive health services delivery and programming, looking at it from a human rights lens. In conclusion, ladies and gentlemen, in the past years, the ministers, secretaries of health and the directors usually met a day before the ministers' meeting. But now, with so much lead time, I hope that you will have enough time to digest the problems, come up with solutions, and make health a lot more meaningful for our people in the Pacific. Thank you very much.